Hi, I am Dr. Vipin Dehane, maxillofacial surgeon and implantologist. I am the head of the Department of Dentistry and Maxillofacial Surgery, Fortis Hospital, Mumbai. Today we will discuss regarding the treatment modality of root canal treatment. So guys, what is root canal treatment? You are seeing your geriatric patients or older patients जिनमें दांत नहीं है. So nowadays we have a modern technique which can prevent your teeth with the treatment called as root canal treatment. So what is root canal? When you have a carious teeth, it doesn't pain. But when the caries enters the pulp, so what is pulp? In your oral cavity or in your teeth, we have a 3 layers in your teeth. Number 1 is your enamel, number 2 is your dentine, and last one is your pulp. The pulp is the most sensitive part of your body or your teeth, which causes pain. So when the caries enter from enamel to dentine, there will not be any pain. But when the caries enter the pulp or when it infects the pulp, that will cause intense pressure. So at this time, when it enters the pulp or when it causes irritation to the pulp, we can't save the teeth with the fillings or other modalities. For that, we have to do a procedure called as root canal treatment. So guys, what is root canal treatment? In the root canal treatment, we make a small access hole in the teeth with a small drill with the proper local anesthesia if needed, and we remove the infected pulp from the teeth or the root canal and then replace it with the gatta parcha or the inert material, and above it we'll close it with the cement, that is the composite or the GIC, and we can go for a zirconia or ebax crown or the metal free crown over it. That will prevent your teeth from removal of the teeth, and that will create a cosmetic results for your teeth. Nowadays, in the Indian scenario, we find that patient comes with caries, but unfortunately that caries enters in the pulp. 80% of the patient which is having a caries, having a infected pulp or the non-vital pulp. So in such cases, root canal treatment is always mandatory. It is one of the safe procedure and can be routinely carried out by the dentist as endodontist. They are the specialized root canal specialists. Nowadays, there are various advances in the root canals. So number 1, we can use an endomotor for the drilling purpose of the canals or the shaping of the canals, which cleans and disinfect the root canals and remove the bacteria from the canals, and also the other techniques for the obturation for the inert materials are also there. So it's one of the safe procedures which can routinely done in the dental practice with the local anesthesia. So I advise people to go for a root canal treatment with the zirconia crown or the metal free crown, and the prognosis of such treatment is for next 40 to 50 years. And it's not mandatory to go for a young, old or the pediatric patient. At any age group, we can go for a root canal treatment. I insist all the patients, it's a very safe procedure and it's routinely practiced in dental clinics, and it makes your life and the teeth healthy. If you don't go for a root canal treatment, it will cause infections of your jawbone in the apical area of the teeth, and it will cause filling in the gums, repeated bleeding, and may resolve the bony structures or cause a big cyst in the oral cavity. In that time, we can't preserve the teeth and the removal of the teeth is mandatory. So guys, go for a root canal treatment for your teeth. Thank you.